Hi, my name is Will McKee, or William Thomas as they call me around here at Yashoda, and I'm from the United States, and I work here in Hyderabad, so it was very convenient to visit Yashoda Hospital, which is a very nice hospital. The building right off the bat is very impressive. I consulted with Dr. Reddy in December, I think. I already knew that I needed a hip replacement on my left side, but he conferred that and did an MRI and an X-ray, and he checked it and said, yes, I need a hip replacement. So after doing some due diligence and checking other places, I came back here. They treated me well. I was ushered to my tests and other doctors very well. Dr. Mohan Reddy gave me a lot of confidence. There were certain things that he did in the surgery that I think were more impressive than what I could have gotten other places, including the United States. Like for instance, he didn't cut muscle, which I think is pretty impressive. I consulted with other doctors, and every doctor generally says they're going to cut some muscle. So I've recuperated very quickly. It's only been 3 days, like to the hour, that I was out of surgery. And I'm already walking like virtually normally. So I gained a lot of confidence from the operating staff. It was my first surgery, so I was a little nervous. Even rolling into the operating room, I was kind of like, ooh, should I be doing this? But no, I had a lot of confidence. I felt a lot better than I expected. If you're looking for a joint replacement, because I know he does knees, and that might be next. I don't know. The knee might be next. Come to Yashoda. It's a very nice hospital too. I mean, you don't get lost here. It's huge, spacious. The rooms are nice. I was really impressed with the rooms. And the nursing staff, of course. The nursing staff is great. Yeah, I couldn't be more impressed. It's nice.
Hello, I am Dr. Mohan Reddy, Orthopaedic surgeon at Yashoda Hospitals High-Tech Division. Today, let me talk to you about Mr. Williams, for whom we did total hip replacement using direct anterior approach, what we call as DAA approach. Mr. Williams is an American citizen. He works in India. He has been having pain in the hip for a very long time, as a result of which he was having stiffness, limping, and not able to do his regular activities, including fitness programs. Mr. Williams is very fit and likes to do a lot of traveling, trekking and hiking. We discussed total hip replacement after having a look at the radiographs. The plain radiograph showed grade 4 hip arthritis. We discussed with Mr. Williams about the implants and the surgical approach. I've explained to him that he needs hybrid total hip replacement, which means uncemented acetabular shell with polyliner with a cemented stem and ceramic head. Mr. Williams inquired about the materials, and I gave him a full explanation of what we do and what kind of materials and implants work well for over 25 years. We also discussed about the surgical approaches. I explained to him about the direct anterior approach. This approach is on the front of the thigh and the hip joint. Direct anterior approach involves no cutting of the muscle, which means there is no significant blood loss, there is no significant pain, and the return to normal activities is very quick and fast. Surgeons can also choose lateral approach as well as posterior approach, where there is a need for more physiotherapy and a slow return to normal activities. Now, to select the patients for direct anterior approach is a tricky business. The patients have to be fit, with good bones, no osteoporosis, no significant obesity, and no significant deformities. After having several discussions, Mr. Williams agreed to undergo DAA approach, total hip replacement. My colleague Dr. Nitish Ban is one of the few surgeons who started that anterior approach few years ago, and now we have the highest volume of total hip replacements in the country using this direct anterior approach. There are no significant complications as long as it is done properly. To do anterior approach, the surgeon needs a good training, expertise and experience. The surgery takes over 1.5 to 2 hours. There are no significant restrictions after surgery. As you can see from the video, Mr. Williams was able to walk the next day without much support. And on the third day, he was walking around in the hospital garden with no limp, no pain, no walking support. Mr. Williams was very happy with the outcome of the surgery, and he wished that he would come back for the other hip replacement if and when the need arises. For more details, you can contact the department at Yashoda Hospitals. Thank you.